Social workers also have responsibilities at the macro level where they advocate for changes that improve entire communities. Rather than focusing solely on one individual or family, macro social work addresses larger systems, policies, and social conditions that contribute to inequality. One important responsibility of social workers is advocacy. Advocacy means speaking up for individuals and communities whose voices are often overlooked. This might include working with local government officials, collaborating with healthcare providers, or partnering with nonprofit organizations to improve access to essential resources. According to Huang and Nimanes, environmental justice requires professionals to recognize how environmental conditions disproportionately affect socially vulnerable populations. Their research emphasizes that addressing environmental problems requires collaboration among community leaders, policymakers, and helping professionals. Social workers play an essential role in ensuring that vulnerable populations are included in these conversations and that their needs are considered when environmental decisions are made. For example, if a neighborhood experiences poor air quality or lacks safe recreational spaces, social workers can advocate for community improvements, educate residents about available resources, and help policymakers understand how environmental conditions affect health and well being. Addressing environmental challenges cannot be accomplished by one profession alone. Social workers frequently collaborate with healthcare providers, educators, public health professionals, nonprofit organizations, and local government to improve community health. Research by Guy and colleagues highlights the importance of community partnership in reducing health disparities, particularly in rural and underserved communities. Although their study focuses on nursing and community collaboration, the same principles apply to social work. When professionals work together, they can identify community needs more effectively, increase access to healthcare and education, and create programs that promote healthier lifestyles. For example, imagine a community where residents struggle with limited transportation to medical appointments. A social worker may collaborate with healthcare organizations, transportation services, and local nonprofits to develop solutions that improve access to care. Similarly, partnerships with schools, food banks, and community organizations can increase access to healthy foods, health education, and preventative services. These partnerships are important because they address the underlying causes of health disparities instead of simply responding after problems occur. Environmental justice also aligns closely with the values and ethics of the social work profession. The National Association of Social Workers Code of Ethics emphasizes the importance of promoting social justice, respecting the dignity and worth of every person, and advocating for equitable access to resources. These ethical principles remind social workers that individuals should not experience poorer health simply because of environmental conditions beyond their control. As social workers, we have a responsibility to examine the larger systems affecting our clients' lives. Sometimes helping a client means providing counseling or connecting them to services. Other times, it means advocating for safer neighborhoods, cleaner environments, improved housing, or increased access to healthcare and nutritious food. By addressing both individual needs and systemic challenges, social workers can create meaningful, long term improvements for entire communities. One of the most important roles of a social worker is helping clients identify barriers that may be affecting their health and well being. While some barriers are personal, many are related to the environment in which clients live. For example, if a client struggles to manage diabetes because they have limited access to affordable, healthy food, simply encouraging them to eat better is not enough. A social worker should also explore whether the client has transportation to a grocery store, qualities for food assistance program, qualifies for food assistance programs, or could benefit from community food pantries or local farmers markets. Addressing these barriers helps clients achieve healthier outcomes while recognizing the challenges they face. Education is another valuable strategy. Many individuals may not realize how environmental conditions such as poor air quality, unhealthy food environments, or limited recreational opportunities affect their physical and mental health. Social workers can educate clients about these connections while providing information about available community resources. Collaboration is equally important. Social workers often work alongside physicians, nurses, public health professionals, school personnel, and community organizations to ensure clients receive comprehensive care. By working together, professionals can develop solutions that address not only immediate needs, but also underlying causes of health disparities. While working with individual clients is important, lasting change often requires improving the community itself. In Taylor, Michigan, one way social workers can advocate for healthier communities is by supporting efforts to improve access to nutritious food. Community gardens, food distribution programs, and partnership with local grocery stores can increase the availability of fresh produce while reducing food insecurity for families experiencing financial hardships. Social workers can also advocate for cleaner air initiatives by supporting local environmental policies, encouraging community participation in environmental planning, and educating residents about ways to reduce exposure to pollution. While individual residents cannot eliminate air pollution on their own, collective community efforts can encourage positive environmental changes over time. Improving access to parks and recreational opportunities is another important strategy. Safe walking paths, playgrounds, and community recreation programs encourage physical activity, reduce stress, and strengthen community relationships. These resources benefit individuals of all ages while promoting both physical and mental well being. Transportation is another area where advocacy can make a meaningful difference. Reliable transportation allows individuals to attend medical appointments, obtain groceries, maintain employment, and participate in community activities. When transportation barriers exist, clients may struggle to access even the most basic services. Social workers can advocate for expanded transportation options that improve accessibility for older adults, individuals with disabilities, and low income families. Research consistently demonstrates that community partnership are one of the most effective ways to reduce health disparities. According to Guy and colleagues, collaboration among healthcare professionals, educational institutions, and community organizations strengthens a community's ability to improve health outcomes and expand access to services. This collaborative approach is especially valuable because no single organization can solve environmental challenges alone. By combining resources, knowledge, and expertise, communities are better equipped to address complex issues affecting health and well being. For example, a local school district, healthcare system, food bank, and social service agency could work together to provide nutrition, education, health screenings, and food assistance for families. These partnerships improve overall health while reducing barriers that many individuals experience every day. As future social workers, we should recognize that collaboration often produces stronger and more sustainable solutions than working independently. As someone who lives in Taylor, Michigan, completing this research helped me realize that our environment influences much more than I previously understood. Before studying eco social work, I tended to think of health as something largely determined by personal choices. However, this assignment reminded me that where we live, the quality of our air, access to healthy food, transportation, and community resources all play an important role in shaping health outcomes. This has also changed the way I think about social work. Supporting clients means more than helping them solve immediate problems. It also means understanding the larger systems that contribute to those problems and advocating for changes that improve the lives of entire communities. As future social workers, we have the opportunity to empower clients while also addressing the environmental conditions that influence health, safety, and quality of life. As we wrap up today's episode, I'd like to leave you with one final thought. Environmental justice is about more than protecting our natural environment. It's about ensuring that every person has the opportunity to live in a community that supports health, safety, and well being. Whether we're talking about clean air, nutritious food, accessible healthcare, safe neighborhoods, or reliable transportation, these environmental factors affect every aspect of our lives. Social workers are uniquely positioned to advocate for individuals while also promoting changes that improve communities as a whole. Through education, collaboration, policy advocacy, and community partnerships, social workers can help reduce health disparities and create environments where everyone has the opportunity to thrive. Thank you for listening to this episode. I hope today's discussion has encouraged you to think about how our surroundings influence our health and the important role social workers play in promoting environmental justice. Remember, creating healthier communities begins with understanding the challenges people face and working together to build solutions that benefit everyone. Thank you for joining me, and I hope you'll tune in again for the next episode.